medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I'm going to discuss today a rarely used test by clinicians, but it's really a lot more important than you could conceive, and I think it's because of lack of real understanding. I'm talking about antidiuretic hormone. Excessive thirst, like polydipsia, intense and persist thirst, as well as frequent urination, large volume of dilute urine, or even up to several liters a day, may be one of the problems that you should be thinking of using ADH. The symptoms can be dry mouth, fatigue, and even dizziness that should be thought about with this too. Electrolyte imbalance is inevitable, and it potentially leads to symptoms as far as cramps, weakness, irregular heartbeat, and weight loss, and of course, a lot of fluid loss is the cause of it. Headaches are also caused because of the dehydration or the electrolyte imbalance. And there is one thing that's quite interesting, and I've used this a lot in patients of this nature, and that is when they're depressed, often the ADH levels are low, associated with changes that include depression. And so be aware of that, because even cognitive changes with this difficulty of concentrating or other cognitive impairments may be part of it. So tests for antidiuretic hormone deficiency, the best way is just an ADH determination and a urine osmolality test, so osmolality test, as well as the ADH will give you the answers that you're probably looking for, because you're going to measure the concentration of particles that are in the urine. In case of low ADH, the osmolality will typically be low as well, and despite high urine volume, so to speak. You can also measure the plasma osmolality, which will measure the concentration of solution in the blood, and it's primarily it is a good method, an easy one to do, and it is and can be suggestive of diabetes insipidus. So get them both, but here's the key. Plasma osmolality, normal range is 275 to about 295. Remember that, 275 to 295. Elevated osmolality or values greater than 295 milliosmoles per kilogram may suggest dehydration. You could have hyperglycemia, sugar excess, protein excess, among other conditions that can do this. Low osmolality values, less than 275, may indicate overhydration, inappropriate secretion of antidiuretic hormone, ADH, or certain medical conditions like the antidiuretic hormone inappropriate release, the SIADH, which you might be remembering. So let me just summarize this concept for you. Urine osmolality normal range, approximately 500 to 800 milliosmoles, but it can vary significantly depending on hydration status. And even urine osmolality values greater than 80 may suggest dehydration conditions where ADH is excessively excreted. So low urine osmolality values less than 300 may suggest diabetes insipidus, so you should be aware. Now, let's interpret this, and because it's complex to a degree, and it's probably the reason not many clinicians are using it as readily as they should, but just know the following. If you have a high plasma osmolality with correspondingly low urine osmolality, it could indicate diabetes insipidus, and particularly if the symptoms include excessive thirst and, of course, excessive urination. Low plasma osmolality with high urine osmolality suggests SIADH, which can take the body and do the same thing despite low solute levels. So look at ADH in patients that you have these symptoms that are just not matching particularly what you're thinking about. Ask the questions about urine and urine osmolality. Take a look and check that in the plasma, and you might get answers that you are missing. Urine, plasma osmolality, and separately ADH. Thanks for watching. Any further information, call me at or write me at Dr. Mitch at mitchghen.com. Let me do that again. Dr. Mitch at mitchghen.com. Thanks again. Bye.